here at the summit. So we hope you're going to be inspired by the solution spotlights that we've included on the agenda over the next 2 days. So in 6 separate 15-minute presentations, we're going to be shining the light on a diverse collection of innovators actively working to respond to the real threats to the future of global health and universal health coverage. So we call these examples of innovation global health solutions in the context of climate change. But first, we want to hear a little more about the ways in which climate change is impacting lives and healthcare systems, particularly in sub-Saharan Africa, and what many experts are undertaking to improve our understanding of the evidence base, where and why we need it most, and why it's so challenging to build. Martin Edlund will moderate a discussion between 2 leading experts in this domain. So ladies and gentlemen, please welcome back to the stage, Martin Edlund.
Hello again, everyone. Can you hear us okay? Excellent. Thanks, Martin and Felipe. So, such a fantastic presentation from Marina Romanello. And one of the things that she said that really stuck with me, despite all the challenges she described, is that addressing climate change is also the biggest health opportunity of the 21st century. And with that in mind, I think this week's session is really well-timed because it feels like we're reaching a tipping point for the climate health conversation. COP27, as many of us know, put a new focus on loss and damages that are inflicted on vulnerable communities. It's refocused the conversation from emitting countries to also take account of the 3.3 billion people that the IPCC's identified as highly vulnerable to the effects of climate change. Mostly, as we heard from Marina, low and middle income countries in the global south. Health is how climate change will be experienced by these people. It's the biggest threat that climate change poses to their lives and livelihoods. So the question for our expert panel now is not whether climate change is impacting human health. We're seeing evidence of that week in and week out, as we've discussed. Rather, it's how best do we respond? And to answer that question, we need to address key knowledge gaps. We need to get stakeholders, academics, countries, implementers, and funders speaking the same language, and more importantly, speaking to each other about these challenges. So we're joined by 2 great practitioners who will share how they're tackling these challenges in their work. First, pleased to welcome you. Dr. Martin Muchangi is Director of Population Health and Environment at AMREF. Martin has 17 years of professional experience in public health in the African context, with expertise in climate change, water sanitation and hygiene, neglected tropical diseases, and implementation of science in those fields. He's devoted his career to designing and implementing innovative, fit-for-purpose public health programs in different contexts across Africa. We're also joined, welcome Martin.
Thank you.
We're also joined by Felipe Cólon-González. Felipe is the technology lead in data for science and health team at Wellcome Trust. He has a background in climate-sensitive infectious disease modeling, and at Wellcome, he specifically focuses on how to fund innovative digital tools and technologies that advance research in climate and health. Before joining Wellcome, Felipe worked in climate-sensitive infectious disease modeling for 15 years. We have friends in common in the kind of geeky infectious disease modeling space. Felipe's contributed multiple papers to several reports by the IPCC on the impacts of global warming on vector-borne infectious disease. So Martin, let's start from you. We just heard from Marina about the myriad ways that global warming is impacting human health, quoting the Lancet Countdown simultaneously and in every country. So you live this reality in the work that you're doing day in and day out. Help us understand what the pressures look like on the front lines of the people being impacted as you try to protect human health in the face of climate change.
Yeah, so thank you so much. Exactly, the question is not whether climate change is affecting health. It's all about how it is affecting health, the magnitude of that, and what needs to be done to address that challenge. So I work for an organization called AMREF Health Africa. Our vision is creating lasting health change in Africa. And so we do believe that health is a human right. Whatever we do it to address the challenges in health. And so we invited ourselves to tackle climate change and health intersectionality, largely because whatever we used to do was getting reversed in the negative. So whether we were trying to advance access to nutrition, you would find that droughts would reverse that. And because the moment there is no food, people don't have to eat anything to eat, then that would be a problem. So looking at the landscape, we are very clear that if you look at Africa, it is feeling the highest impacts of climate change. I checked some statistics, and it's clear that about 1.7 million people are dying because of malnutrition. Where I'm coming from, Kenya, right now, there's a major drought. 5 seasons of failed rains, no food production, failed agriculture, livelihoods are failing, children are not going to school, and so you can imagine the ripple effect of all that. When you look at the infectious diseases like malaria, in some circumstances where we had no malaria, now we have malaria in the highlands of Kenya. And that goes all the way to neglect and tropical diseases. They are on the increase. 500 million people in Africa are infected, and they are affected, and climate change is worsening this because of lack of access to water and sanitation. So now, the key thing is just some key reflections around what we need to do to ensure that we are addressing this issue in a focused way. And some of the reflections that I picked from those who I have discussed with is we all need to invite ourselves to imagine the way we finance the actions around climate change and health. If you look at the facilities that are in existence, it is so difficult for anyone to apply and get that money, and especially when you are taking the angulation around health. So we need to invite ourselves to imagine the frameworks that we need to put in place, the value proposition that we need to advance to the climate change, or those who are deeply engaged in addressing climate change. The second element is we cannot move forward systematically without effective community and government engagement. So there's a whole science around engaging communities in the best way possible. I was discussing today, again, how we are imagining getting the communities on board using technologies, artificial influence, involving them to imagining and envisioning their future. So that's the second thing which we need to really think about quite effectively. The third thing is around systems thinking. As you heard from Marina, we cannot address climate change and health issues from just only one sector. So we need to think about the integrated services and how we can bring all that on board, multi-sectoral collaboration, what part health can do, what part agriculture can do, all those sectors brought together. And lastly, it's all about thinking about technological transfer. Marina said clearly that it's not all about how much Africa is producing, because we are clear that in terms of greenhouse gas emissions, Africa produces only 4%. But then the question is, if the technology that helps in terms of mitigation or reducing the greenhouse gases is not available in Africa, how then can Africa move forward to be part of the contributor towards net zero emissions? So technology transfer is a key issue. I want to end by just pointing out that AMREF, together with the Rockefeller Foundation, attended COP, and during COP, we convened a side meeting. In this side meeting, we wanted to get insights from practitioners, from government, civil societies, about the key things that need to be followed through, the practical steps that need to be followed through to address climate change and health. There are a few things which emerged, and I think I would need to share this here because I think it's necessary to inform actions forward. One key issue that emerged is the element of One Health. How to ensure that One Health is embedded within health and environment policies. It becomes part of the implementation framework, and it's effectively adopted. So the second thing which came out clearly is, although in general we would say that there is evidence that climate change is affecting health, we need micro data for purposeful programming. So that is something else which emerged very clearly. The other element which came out clearly is, of course, multi-sectoral collaboration and thinking systems. And lastly, it's all about the early warning systems for the purpose of preparedness. And in this case, it's not just looking at meteorological data or epidemiological data alone, but it's speaking epidemiological data, meteorological data, and combining it together with the citizen science. We always assume that the people who we serve know very little, but then the key issue is to listen to them, get to understand the trends as they know them, and use that to corroborate and create a whole big picture. Thank you.
Thanks, Martin. Fascinating insights from that conversation. And of course, we talk about climate change as if it's a global issue, and of course it is a global concern, but the health effects are felt locally. You talked about microdata, you talked about local early warning systems and citizen science. What are some examples of promising ways that communities are adapting or preparing to adapt to the effects of climate change on health?
Excellent. First of all, I would want to point out that building the capacities of communities, building the capacities of health workforce to be responsive and adaptive to climate change is one of the key things. And so what I have seen happening, and very effectively, is that, first of all, we are engaging universities and governments to build curriculums that then can help to train a fit-for-purpose health workforce, pre-service and in-service. And we can get very practical by ensuring that whatever we put forward is cost-effective and sustainable. So as such, like where I work from, we have devised systems that can ensure that new knowledge is transmitted without really calling for expensive meetings through M-running, electronic running, and all that. So that's point number one. Then point number two is how to engage the communities to start implementing adaptation measures that are commercially oriented. It's very clear that we cannot move forward with subsidies to facilitate adaptation and mitigation. So what we need to do is, and what is happening already, is we are supporting communities, youth groups, women to develop bankable business cases. Whether it is in nutrition, whether it is in water sanitation and hygiene and all that, and ensuring that there is commercial angulation so that the money which we get as grant is basically used to kickstart the process, but then scaling up happens because of the commercial model or entities that we have embedded into the programming. Yeah.
Thanks, Martin. It's fascinating, and there's such a push led by the WHO and others around expanding the frontline workforce, community health workers, and so I like the idea of thinking about climate adaptation and how that frontline workforce can be a big part of that, how CHWs become climate health workers as well as community health workers. So Felipe, let's turn to you. One of the mantras that we hear from Wellcome Trust and others is the need to build a better evidence base for the effects of climate change on human health. We've just heard from Marina about much of what we know, but what's your sense of where we have good evidence, how we got it, and what are the big gaps that we need to prioritize?
Thank you, Martin. If you allow me, I'll prepare some notes. I'll
Yeah.
just help myself with some notes that I have. Well, I think first of all, we have to acknowledge that we're gathered here today because we accept that the climate crisis is a health crisis. As temperatures climb and the ecosystems become more vulnerable, the consequences are playing in front of us. We've been hearing about food insecurity, water shortages, infectious diseases, and they're becoming more frequent, more evident, and more severe each time. Climate change is worsening, particularly in the field where I work in, the impact of infectious diseases. We heard that malaria, for example, that has been typically present in low-lying areas is now increasingly observed at higher altitudes in areas of Africa and Latin America, and is re-emerging in other areas like Greece, where it had been previously eradicated. Dengue, that was typically constrained to tropical and subtropical areas, has started to increase to temperate areas like European countries or Japan, where it has started to generate local outbreaks of disease. The extent of the increase in the climate extremes is also generating suitable environments for cholera and tuberculosis to thrive. And these changes have been facilitated, of course, by climate change, but also by other stresses like global urbanization, extended international travel, forest degradation, all of which that are becoming more and more evident and more pervasive, particularly in low and middle income countries. So the path forward is not clear-cut. We accept that we do not have yet all the solutions for all these complex problems, but we have to use opportunities like this summit to exchange ideas, share knowledge, and inspire one another to take action. And in my field, which has been over the past 15 years, the use of technology and models is really essential for this field. So data, tools, and talent are essential for thriving change. If we do not have enough data to understand the present, future projections of climate impacts on health are going to be questionable. So we need better tools and better data to understand how diseases behave and to prevent outbreaks. We also need, as we have heard from Martin, from Marina, from Dr. Tedros, to build local capacity. We need better climate and health professionals to generate the science, to apply the science and the technologies to protect our health. And in this case, digital tools play an essential role to help us track, monitor, and predict potential outbreaks, and to be prepared as much as possible. And one of the most important digital tools available is infectious disease models. The importance of infectious disease models became clearer than ever with the COVID-19 pandemic. Early modeling projections allowed us to understand the pandemic potential of the disease, but it also guided our local responses to an increase in hospitalizations and deaths. The projections of international spread also allowed us to understand how this disease could spread between countries and influence travel restrictions and border closures. As a result, policymakers rely in infectious disease models now more than ever before. If we translate this into the climate and health space, models informed by climate information allow us to understand how diseases can escalate or how can they spread, but also how we can prevent this from happening. The problem is that the lack of standardized baseline or reference periods, climate modeling scenarios, and modeling methods and geographical scales make comparisons between models very difficult. And so we have different models generated by different groups, all of which have their different sources of data, their different modeling approaches. And so there is a lot of disagreement, not only in the levels of risk that we can experience, but also in the geographical areas where expansion or intensification of the impacts can happen. Also, there's a wide range of models that are generated in academia with the intention, a very good intention, of guiding policy making and decision making in the ground. The problem is that the evidence for the effectiveness of these models is rather weak. To the best of my knowledge, there hasn't been a thorough assessment with gold standard methods of the effectiveness of these models. A recent review that we commissioned last year revealed that only 1/4 of the tools that are available for climate-sensitive infectious disease models has interfaces that are accessible or usable by decision makers. And if these tools are not accessible and usable for decision makers, their ability to use them for policy making or decision making processes is rather compromised. And this highlights, as Martin pointed out, the need for communication between sectors, not only between academia and decision makers, but also between academics in the health space with academics in the climate science space, for example. Another big issue is that the current funding mechanisms do not recognize the support and the long-term maintenance of these tools. So when the researchers need to extend, refine, or maintain these tools, they do not have the funding to do so, even if these models have proven to be highly effective for their communities that they want to serve. And lastly, I want to highlight that most of the models that are generated for areas of the world where these diseases are endemic or widely expanded are developed mostly by North American and European institutions. And the lack of representation from the local knowledge in the generation of these tools can lead to ineffective or inadequate solutions. So what can we do to address these gaps? Well, first, we need to invest in the development of new talent. This includes, as Martin pointed out, the generation of university programs and career paths at the intersection of climate and health, with the particular emphasis on countries that are experiencing the biggest impacts. And this is going to help cultivating the next generation of climate and health professionals. Second, we should make every effort possible to ensure that researchers from the regions most affected by climate change are better represented in the process of developing this knowledge and the tools that are going to be used to address them. And this is going to enable us to design tools that are fit for purpose. And it will also allow us to identify gaps and barriers for their adoption and implementation. And it's going to allow us to design mechanisms to address these problems. Also, involving stakeholders from these regions is going to help us build local capacity and foster local innovation, which is largely needed. Third, we need to improve data curation and sharing, because as our planet continues to warm, we need to have accurate and comprehensive data sets to not only to understand what the impacts of climate change are going to be, but in the case of infectious disease modeling, we need to have better data to train the models. Ultimately, the effective curation of these data sets is going to generate more effective policies, improve our public health, but also it's going to generate better models for understanding what we can do about it. So we need to build a more collaborative approach as well between academic and policymaker sectors, because this collaboration is going to generate more effective tools. So just to conclude, I think we acknowledge that addressing the climate crisis is really important, and we must put health at the heart of climate change action. And to do that, we require better communication between sectors. Our health is at stake, of course, and it's only by taking action that we're going to be able to prevent further damage.
Terrific. Thanks, Felipe. You talked a lot about challenges at multiple levels, the structure of data, the sharing of data, the need for community data workers almost, data coming from and informing decisions at the local level. I'm struck by the mitigation conversation. Think about how hard it is to understand the weather and how it's changing over time, and the parts per million of various things in the atmosphere. We need that same rigor and precision on the health side to understand how kind of climate and health are interacting and what we do about it. So Wellcome has made big commitments around this. What are your priorities in the next 6 months? What are the investments that you guys are seeking to make, or that other funders can help to make, to close these knowledge and data gaps?
I think if I had to do something really urgent in the next 6 months, is increase representation of the most affected areas in the development of data and tools that are going to be used for guiding not only the evidence that is going to be gathered about the problem, but also the solutions that are going to be used for addressing the gaps that are identified and the challenges that are being identified. And we're putting quite a lot of effort in making sure that representation of the most vulnerable populations is considered in the development of evidence and solutions. So just to give you an example, last month we announced an investment of just over £22 million in the development of new cutting-edge digital tools for understanding the impacts of climate change using models. And it was a requirement from the institution, from the Wellcome Trust, to have local representation in the teams that were going to generate the solutions. We wanted to ensure that there was, that not only that the projects were transdisciplinary, but that they were including knowledge from the regions that they wanted to serve.
Thanks, Felipe. We talked earlier today about our aspiration that health is, our recognition that health is among the best investments we can make in climate adaptation dollars. But I'm struck that we need to improve communication between researchers, practitioners, government policy decision makers in order for us to get there. So how do we do that? How do we connect the dots between the data and the research that you're leading at Wellcome, Felipe, Martin, between the work that you're doing with community health workers and decision makers in government? How do we bring these things together? Martin, maybe to you first.
Yeah, sure. One of the key insights that is coming into my mind is if we want health to be mainstream within climate change conversation, then we need a unique value proposition that we then move forward to take to the table of climate change sector, environment, agriculture, and all that. So up to this point, what we are talking about is the challenges that climate change is doing to health. Mm-hmm. But as a community, as practitioners, I don't think we have very concrete solutions that we can take to the table of the environment sector climate change conversation and say, we are bringing this to the table. And so we become co-investors. And I'm so happy COP26 already moved a step forward in terms of thinking through what we can do in terms of decarbonizing production of health, but that's not enough. So we need to think a little bit bigger and appreciating the fact that health is not produced in hospitals, those are garages, taking one step behind, going back to the communities and thinking about what we need to do as a health sector in the communities to decarbonize production of health in the form of primary health care or primary prevention. So that's one of the key insights that needs to happen. Then the second thing, and I'm so happy that, again, we are inviting ourselves to think networks around how to bring multiple researchers, around how to bring multiple efforts together, Pan-African, Pan-American, all those centers of coordination. Mm-hmm. So coordination is one of the key things that then we can think of how to improve to ensure that interoperability, sharing of lessons happens. Yeah, thank you.
Felipe, anything you want to add?
I completely agree. I think coordination is key, and building participatory approaches will help us move towards that goal. So we need to make sure that we involve people or as many stakeholders as possible in the conversations and in the generation of evidence. But also I think one of the key things that we must increase as well is the generation of evidence that climate change is playing a key role in the health outcomes that you were observing. And just to give you an example, if today a person dies in the middle of any city, London, Karachi, in a particularly hot day, the WHO autopsy, for example, does not have at the moment questions or metrics around the environmental conditions of that particular day. So you may know whether that person had a cardiovascular problem, but you are not going to know whether there was a heat wave during this day. So we need also to strengthen the evidence for making sure that the linkage between climate and health is established in every point down the pipeline of the data generation, so we can make sure that when the climate change negotiations happen, we have robust evidence to demonstrate that there has been an impact. At the moment, we do not have metrics to monitor and track the effects of climate on health. And this is why the Lancet Countdown, for example, is becoming a very big and impactful project. We are funding another project with the Office for National Statistics that is collaborating with stakeholders in Kenya, Ghana, and Rwanda that is also going to develop a framework for generating metrics for monitoring and tracking the impacts of climate change. So yes, participatory approaches are really useful, but also the generation of evidence is going to be key.
That's great. And part of it is, as you say, attribution. We've all heard so much about the loss and damages conversation, but unless we can track the costs of human health back to climate change, it's really hard to make that connection. So let's open it up to questions and a conversation from the group. I know we have some roaming microphones, so just raise your hand. I see a few back here if you want to ask our panelists a question.
Popular table. Thank you so much. It's really interesting. I'm Alison Malmquist. I'm the director of PSI's Global Sexual and Reproductive Health Programs, but also lead thought into where we might participate a bit more in the climate conversation. And Martin, you had mentioned working with women's and youth groups to build what I think you referenced as sort of business cases for investments. And I'd just love to hear more about what kinds of solutions you're seeing coming through and how you're building those business cases with those groups.
Okay. Yeah, sure. So I can.
I assume she means you, Martin, not me.
Okay. Yeah, sure. So last week we were in Kigali, Rwanda. We hosted a hike, and part of the hike was to launch what we are calling the Raising the African Voices. And Raising the African Voices was born out of collaboration with another organization which is dealing with climate change and health issues. And so what we did is inviting the youth to undertake a competition in the form of a hackathon. We pre-selected 4 of them, really with novel ideas, very good ideas on how to address climate change and health. So in short, what we do and what we are doing right now is, first of all, to call for those ideas out there, and then using small grant money, financing that to already start picking up. But in mind, we are very clear that we must have a commercial entity that then brings some commercial funding into the entire system. We are not in default of financial inclusion. There's a whole big project called FINISH. FINISH stands for Financial Inclusions, Improve Sanitation and Health. That project began in India. We are doing it in Kenya, Uganda, Tanzania, and Ethiopia. And what we do is to work with financial institutions. We do financial literacy. We capacitate entrepreneurs to develop commercial solutions for sanitation. So there's a whole big picture around building that now for climate-oriented interventions. And we can discuss more about how we can take this forward together. Thank you.
Thanks, Martin.
Thank you. Thanks very much. I'm Fiona Smith-Layton, Head of Strategy and Operations at the pharmaceutical company GSK. Martin and Felipe, that was awesome. Thank you. The thing of the many things that I've written in my book that I'm most interested about is how we use local data and connect it to make better decision making. So I wondered if you could both expand a bit on citizen science, the role of citizen science, how we encourage citizen science, and if there's a role for broader funders and public sector to help support that.
Yes. Certainly, yes, that would be a very interesting venture. Thinking about how to include public sector within this conversation, having the government leadership and ownership of all these processes, whether it is data, whether it is the interventions and all that. So it will be very exciting to explore that, and we are open for that. I think just the other day, we stopped short of launching the African Center for Climate Research and Policy, and this is because Marina clearly said that they are moving to Africa, so we are thinking about how to support that process using our university and the networks that we have, so that we build a whole big picture. So it will be very nice to really follow this moving forward. Yeah. Thank you.
I just can add that citizen knowledge can be key for the development of strategies for mitigating the effects of infectious diseases, for example, on the ground. Just to give you an example, we are funding a project called Harmonize that is led by the Barcelona Supercomputing Center that is going to be using local science combined with meteorological station and drone technology for the development of early warning systems for several infectious diseases, malaria, cholera, and dengue, for example, in different regions of the world. And this project is going to be using citizen science to guide the development of tools that are not only spatially relevant to decision makers, but also that can be owned by the local communities. So there's quite a lot of public engagement going on with the relevant communities on the ground to make sure that the tools are fit for purpose, but that are enriched by the big knowledge of the conditions and the impacts that people are suffering on the ground.
I think we have time for maybe 2 more questions.
Lottie Rennick, Malaria No More UK, and thank you both for such an interesting conversation. We are seeing the invasive species of mosquito Anopheles stevensii entering Africa now, and this is really particularly worrying for malaria because it's more climate resilient. We think it can thrive at higher temperatures. It may lead to longer malaria seasons. I'm just wondering if this factor is already in the modelling, climate change and malaria, or if we still have a really big knowledge gap around this.
There are some studies that have started to include that factor in the modeling. There was one modeling study that was led by Erin Mordecai a couple of years ago that demonstrated that if Anopheles gambius starts fading out and Anopheles stevensii starts bringing in, that can be a very big problem, not only for malaria, but also for it opens opportunities for other diseases like dengue to start colonizing more urbanized areas. So there is a big knowledge gap still in the modeling community about that particular issue, but the evidence starts to be generated.
Yeah, Felipe, it's such an interesting issue because you have an urbanization of populations in Africa, and stevensii is an urban mosquito. So malaria, we often talk about it as a disease of the rural poor, but it may become, like dengue, something that affects city centers as well. Another question?
Hi, my name is Tam Rabi. I'm a lead health specialist in the World Bank. And my question is to you, Felipe. So you're looking at the links or the impacts of climate change on human health, but how much is Wellcome doing the other way around, looking at the impacts of health sector activity on climate change, meaning the carbon emissions? Are we looking at that? Are we taking it down below, the system level and below that? And, equally so, obviously, Martin, I guess, you may be doing some of those things also at a healthcare facility level by looking at clinical pathways and how we could move towards low sustainable carbon clinical pathways. Thank you.
So just to give you an overview of what we're doing in Wellcome in regard to that. So at the moment we have one program that is going to be looking at how can we better attribute climate change impacts on health. So that's to generate the information that we need to start engaging in these climate change negotiations and provide evidence for loss and damage, for example. That's one of the things. So we are going to be generating evidence about how to better attribute climate impacts on health. And the other thing is we're going to start our package of work on climate change mitigation. But that's still very much work in progress. We are going to appoint a head of mitigation within the trust. But one of the things that we are doing is we're going to start exploring what are the potential co-benefits of mitigating climate change for health. But I think we're going to be better prepared I'll be better prepared to answer that question probably in about 6 or 8 months' time from now.
Martin, anything you want to add?
Yeah, sure. I think the most important thing is to appreciate that we need to cut down the number of people who are actually coming to the health facilities as part of decarbonizing. So if you can keep as many people not sick and not getting to the hospitals, then the carbon dioxide which is produced during production of energy, the waste which is produced during treatment, then drugs that are synthesized to treat, I tend to think that that is part of what we can do. But of course, there's a whole thing around calculating how that contributes to that. But the best strategy, let's keep people not coming to the hospital by implementing effective primary healthcare services. Yeah.
So this is maybe a good opportunity to preview a couple of spotlights that we'll have over the next couple of days. We'll be looking at 2 compelling examples of how, in the course of protecting health, we can have a significant mitigation impact. So we'll hear from the Clinton Health Access Initiative about a clean cooling initiative. So as heat stress worsens, particularly in South Asia, and you have a growing middle class, people are buying AC units at an unprecedented level. But those are currently low cost, but very dirty in terms of their emissions. So how can we do market shaping to drive toward cleaner cooling units that, according to their modeling, could prevent as much as 50 gigatons of greenhouse gas emissions in India alone by 2050. So we'll hear more about that. We'll also hear from Nobel laureate Michael Kramer and his group at the University of Chicago. They're partners in evidence action looking at some water safety initiatives that can have a big impact in preventing people having to boil water in order to make it safe and drinkable. That would have a big offset effect. And the clock has shown me we're out of time. I see our next speaker is here. So let me just thank our panelists, Martin and Felipe, for a really interesting conversation. Appreciate your insights, your leadership, and your partnership.
Thank you very much.
Please give them a round of applause.